So last but definitely not least, our final speaker is Bek Lamb from Ascham in Brisbane in Australia, who's going to tell us about enhanced self-efficacy in HCV management, evaluating outcomes of MDT workforce education programs across 5 African countries.
Thank you. Lucky last. Good afternoon, everyone. Today I'm going to be sharing outcomes from our hepatitis C workforce education program, delivered across 5 African countries between 2022 to 2024. I'd like to begin by acknowledging and thanking the steering committee members that really implemented this work and the peer lived experience speakers who also participated in the program. This project was a collaboration between INSU, Ascham, the Kirby Institute and the South African HIV Clinician Society. So it was really a group effort. And the program was supported by a medical education grant from Gilead, and I have no disclosures of interest. So, this program really aimed to strengthen the capacity of healthcare professionals working in drug and alcohol settings and also primary care settings to effectively test, treat and manage hepatitis C. The program combined online learning modules, so we had one tailored to each country, we had a facilitated workshop in each country, and also a toolkit that participants could take at the end of the program as well. We adapted all of these materials to local guidelines and languages as well, in collaboration with those country steering committees who really provided the strategic direction and guidance as well on adaptation and delivery. So in total, we reached 6 workshops with 211 participants across South Africa, Nigeria, Morocco, Egypt, and we also had a regional multi-country session as well. And importantly, we also adapted the training materials for Kenya, which are embedded for future use by NASCOP. So participants completed pre, post, and a 3-month post-course survey, and that was using multiple choice questions to measure knowledge, and then also a 5-point Likert scale to assess confidence across 7 key core competencies for hepatitis C. So, what were the findings? We did have strong, sustained improvements in both knowledge and self-reported confidence. Knowledge increased by almost 13% immediately post the workshop, and then by 26% at the 3-month mark. And confidence improved by 36% post-program and remained nearly 39% higher at follow-up as well. But some of the biggest gains were actually in practical skills. So for example, in Egypt, confidence in assessing liver disease severity increased from 0 to 60%, along with in South Africa, confidence in educating patients about hep C risk factors rose from 0 to 60% as well. So, in conclusion, the program, it did achieve meaningful and sustained improvements in self-efficacy across those 5 African countries we worked in. We were also able to create these enduring, country-adapted resources for future hep C care and education, and we have shared those with local partners as well. And I think, it really strengthens a foundation for scaling up hep C testing and care in these settings as well. The project, I think, probably for me, my biggest takeaway was that the project provided this platform for stakeholders across these countries in this region to really share cross-country learnings, foster collaboration, and knowledge sharing as well. So future opportunities would include delivering more of these trainings in the region. This was a pilot, but I think really embedding and integrating with the existing systems to really maximise that broader reach and have that sustainability of a program like this within each country. So making sure it's embedded into the Ministry of Health education programs. And I think as well, evaluating project impact outcomes would be really beneficial. So thank you.